So let's talk about medical errors and their impact on the results, especially in the laboratory. Research shows that 70% of lab errors happens before the test reaches the machines or the analyzer. So that simply means that these are errors that happen pre-analytically. In the lab, we normally have three phases. We have the pre-analytical phase, we have the analytical phase, and we have the post-analytical phase. Where the pre-analytical phase normally entails sample collection, patient preparation, sample labeling, sample transportation, and sample storage. And here is where research says that most of the errors occur. In the analytical phase, we have the actual testing of the sample, the use of the machine and the reagents, the calibration, running of the controls, and the generation of the result. And the post-analytical phase entails result interpretation, result validation, communication of the result to the doctor, the clinician, and entry of the report into either a system or where you keep your records. So when these errors are avoided, because even the most advanced machines or analyzers cannot correct a poorly collected specimen or a poor sample. When the sample comes when it's not as per the standard, the machine will just use it as it is. So when we talk about pre-analytical phase, let's discuss some of the most common issues that arises there that normally leads to production of wrong results or results of poor quality. Number one case is normally the hemolysis due to maybe improper venipuncture, maybe due to clotting of the sample, especially these ones that are placed in containers that has anticoagulants. So when the sample ratio to the anticoagulant ratio is not up to the required standard, there is possibility of clotting or even hemolysis to occur, and that will automatically appear with the quality of the sample. There can be sample degradation that might be caused by delayed in transport or maybe poor storage. And also there is misidentification of the sample, maybe from labeling errors, patient having the wrong identification number or the wrong name, leading to giving the incorrect result to a patient. So it is important that we establish standardized protocols. We do staff training and quality checks, which are very essential in safeguarding the patient results. So when you follow the standard guidelines and avoid these errors, the sample will reach the machine of the analyzers when it is of the highest quality, and you will get the quality results as per the required protocols. So it is important to note that every quality result or a quality diagnosis begins long before even doing the test. How you prepare this test, how you collect this sample, how you store this sample, how you transport this sample will determine how the sample will be quality enough to produce a quality result. So let's try as much as possible to avoid this kind of pre-analytical errors, because right now most of the machines are automated. You will just load the sample and the machine will do most of the work. So if you load a poor sample, a poor quality sample, will lead to you to getting a poor quality result. So we need to establish a well-established process to ensure that we use the best and the most quality sample while running our test in our various laboratories. So we need to ensure that things like correct identification or maybe the barcoding are there before you begin to run your test. Proper documentation of details right from the age of the patient, maybe the clinical history, the name, patient number, things like that. You need to check such things prior to collecting this sample to ensure that everything is up to the standards that are required. Storage, storing the sample at the correct temperature. Most lab samples are normally stored at 2 to 8 degrees, but there are samples that require room temperature. There are samples that are to be run immediately. There are samples that are to be stored in a freezer. So you need to take note of that to ensure that you get the quality result. These things should also be seamless to ensure easy traceability and audits when necessary. So sample management is an important thing to note while working in the laboratory. There are normally two phases in sample management. We have the uncollected sample and we also have the collected sample. Uncollected sample, these are always new orders or new requesters come in. You need to check if everything is right, identification, the patient name, age, everything is matching with the patient before you proceed to collect your sample. Uncollected sample can also be due to maybe there is holding, maybe patient has not been billed, or the patient has been cancelled, or the request has been cancelled due to various reasons. And number two, we have the collected samples. And collected sample can either be accepted, can be rejected, can be held, that is stopped for some time, or maybe it can be also be held, waiting for confirmation of some details. So a sample is only accepted when it meets all the requirements, like the correct identification. There is test requisition form that contains the clinical history and all the details required. The sample is well labeled, the sample is of the right temperature, the sample is of the right quantity. Such sample is accepted and can proceed to the analytical phase. When these standards are not met, then the samples is qualified for rejection. Damage, insufficient, mislabeled. Such samples are normally marked for either repeat collection. Mostly you repeat collection so that you get the right quantity from the right patient with the right details. So you can hold sample for some time. Maybe sample has arrived in the laboratory. You hold it, just stop it, put in somewhere waiting, maybe for the requisition form has not arrived, but the sample is well labeled and has the right quantity in terms of the anticoagulant and the sample ratio and all that in the right container and all that. So let's be keen on this face to avoid getting poor quality result. Take note of that. You engage your patient, you ask them question to find out if everything is matching with the TRF, the test requisition form. That's all for today. We'll discuss about the analytical phase in our next episode. Thank you, and follow for more. Subscribe to our YouTube channel, and let's keep learning.